My name is Dr. Jenny Yoon. I'm the Medical Director of Women's Imaging at Florida Hospital in Orlando, Florida. I've been practicing medicine for about 12 years now. I specialize in women's imaging, which includes interpretation of mammograms, breast MRIs, breast ultrasounds, breast PET scan, and so forth. The reason that I started this show is to kind of share with you my knowledge about breast cancer, how we diagnose it, how we can prevent it and detect it early. So the next 4 series of shows, we're calling them Protecting the Girls, meaning how we protect our breasts. So I hope you will come with me on this journey about learning about breast cancer, how we diagnose it, and some of the information regarding breast cancer that may help you in terms of looking for the signs of breast cancer. So today we're going to talk about how we diagnose breast cancer, risk factors that may put you at an increased risk for getting breast cancer. So start by looking at some of the statistics. A lot of you may have heard that breast cancer affects 1 in 8 women. It is the second leading cause of death in women, and it's the most commonly diagnosed cancer in women. Last year, about 40,000 women died of breast cancer. All of these statistics seem depressing, but the good news is that breast cancer can be cured if found early. You'd be encouraged to know that there are over 2.5 million breast cancer survivors in the United States. And being diagnosed with breast cancer doesn't mean you're going to die. If we find it early, it can be treated and it can be cured. And the important thing to remember is that breast cancer can be cured if we find it early. If we find it small, we can treat it and cure it. If it's too big, then it's harder to treat. So what we want to do is find cancer when it's small. And we can detect small cancers by doing 3 simple things. One is to do a breast self-exam every month. And to learn how to do that, we're going to, you can go to my website called pinkispowerful.com, or you can ask your doctor on how to do that. You can also get a mammogram every year if you're 40 years of age and older. And the other important thing is that you need to see a doctor on a regular interval, at least once a year. So let's talk about doing a breast self-exam. The important thing here is that you need to do it at the same time every month. If you're still having menstrual periods, you know that the consistency of the breast changes depending on your cycle. So it's important to pick the time at the same time of the month every month, so you know it's the same consistency of the breast that you're feeling. So if you're still menstruating, it's best to pick a time when you're done with bleeding. That may be a day or 2 after your period stops. That way you're catching the breast when it's softest, because you don't want to start feeling for breast lump when your breast is lumpy. And also, goal here is that you need to learn how your breast feels. Over time you'll get really good at it if you do it every month. Like I tell my patients, practice makes it perfect, and you're the only person who knows your breast the best. So by doing it every month, you get to be really good at detecting small changes. Now, if you're one of those women who've undergone menopause and you're not having periods anymore, then you can just pick a date of the month, and if you're like me who can remember dates, you just mark it on your calendar so you know it's time to do your breast self-exam. The goal of breast self-exam is to obviously detect small changes in the breast. You're looking for any lumps, any thickening, nipple discharge, or any change in skin color or texture. And if you notice any of these changes, it's important that you need to call your doctor immediately, because these can be signs of breast cancer. The second way that we detect breast cancer is obviously a mammogram. The current American Cancer Society recommendation for getting a mammogram is starting at age 40, you get one every year. And the third way that we can help diagnose breast cancer early is that you see a doctor at least once a year and have that person do a breast self-exam. And the important thing is if you combine all three methods, that helps us detect smaller cancers than if we did one of these alone. And let's move on and talk about breast cancer risk factors. Most of the breast cancers are sporadic, meaning there's no risk factor or any underlying cause. But some of the women have what we call risk factors that increases their likelihood that they will get breast cancer. Having a risk factor doesn't mean that you will have breast cancer, it just means that you're more likely to get it. The risk factors for breast cancer include, number one is getting old. Just because you're getting old, your risk of getting breast cancer gets higher. So getting old sucks, but that's the way life is. Now, if you're one of those who've already had breast cancer, we call that personal history of breast cancer, then getting another cancer in the same breast or in the opposite breast is much higher than somebody who's never had breast cancer. If you have family members who are affected, especially your mom, your sister, first-degree relatives, or if you have multiple families who are affected, then your chance of getting breast cancer is much higher. Now, if you have multiple family members who are affected, that may mean that you have breast cancer due to an inherited cause, due to an abnormality in the gene, and you might have heard of entities called BRCA1, BRCA2, or sometimes called BRCA1 and BRCA2. So if you have one of these gene abnormalities, we call those mutations, then you're at much higher risk of getting breast cancer than somebody who doesn't have this gene abnormality. And if you have this gene, then you're more likely to get breast cancer when you're quite young, usually in the 30s and 40s. If you want more information about this high risk and genetic predisposition to breast cancer, you can go to my website, pinkispowerful.com. Other risk factors include if you had a breast biopsy and the biopsy result shows you entities called atypical ductal hyperplasia, atypical lobular hyperplasia, or LCIS stands for lobular carcinoma in situ. These also put you at increased risk. If you received high-dose radiation to the chest, for example, for treatment of Hodgkin's disease when you were young, the damage done by that high-dose radiation put you at an increased risk. Other less significant risk factors include never being pregnant, starting menses earlier, or undergoing menopause later, and all three of these relate to how long your breasts have been exposed to estrogen. Because if you have menses earlier and you go into menopause late, you're exposed to longer and higher level of estrogen than someone who started menses late and went into menopause earlier. So the lesson from today's program is that breast cancer can be cured if diagnosed early. And to diagnose breast cancer early, you have to do three things. One is breast self-exam once every month, get a mammogram once a year, and see your doctor on a regular basis so you can detect any small changes that may be signs of breast cancer. This is Dr. Jenny Yoon. See you next time.